So the first line drug to treat hypertension in diabetic is ACE inhibitors. But if the GFR of the patient is less than 30, or if the patient is having renal failure, then ACE inhibitors are contraindicated, or they cannot be prescribed to patient with renal failure or decreased renal function. So why ACE inhibitors are used for diabetic hypertensive patient? Because they are renoprotective, they provide protection against retinopathy, and they also has a positive effect on glucose metabolism. So that's why ACE inhibitors are preferred in diabetic patients. Now, what is postural hypotension? Postural hypotension is a hypotension on changing the posture. For example, if patient stand up from a sitting position, a drop of systolic blood pressure of at least 20 mmHg within 3 minutes of standing is known as postural hypotension. So a drop of 20 mmHg of systolic pressure and 10 mmHg of diastolic pressure on standing is known as postural hypotension. Postural hypotension is common in old or elderly people because the baroreflex mechanism in elderly people, the baroreflex mechanism in old people, the mechanism is also old. So it has difficulty in controlling the minute to minute variation of blood pressure. That's why postural hypotension is common in elderly people. So in Plab 1 exam, if an elderly person who is taking multiple drugs present to you with history of fall, then you will suspect postural hypotension. So an elderly male or an elderly man with a history of taking multiple drugs, you will suspect postural hypotension. What is the management of postural hypotension? Blood pressure monitoring and review the patient's medication. Now, some differential diagnosis of syncope.
Can you say about the baroreflex, please?
In older people, the baroreflex is also old because with a declining age, the efficiency of this baroreflex mechanism is decreased. Normally, uh, minute to minute or even second to second variation of blood pressure, they are controlled by the baroreflex mechanism. So normally, if there is a drop in the blood pressure, the baroreceptors are stimulated, and they stimulate the sympathetic system in the cardiovascular area in the brainstem, and this stimulation of the sympathetic system will result in increase in the blood pressure. So basically, the baroreflex mechanism don't let the blood pressure go down very much. But in older people, this system is also old, so the efficiency of this system is decreased. So that's why elderly people develop postural hypotension.
Okay, thank you.
So how to investigate a case of syncope or investigation following syncope? So patients who have unannounced loss of postural tone leading to a period of unconsciousness need to be investigated for four main causes. The first important cause is arrhythmias, because arrhythmias can lead to dizziness and syncope. Arrhythmia usually are sudden and abrupt, and the recovery is also abrupt. So, if a patient present to you with a history of uh, unconsciousness and that he become conscious after 2 to 3 minutes with flushing, then you will suspect a cardiac arrhythmia, and you will order a 12 lead ECG. And if the 12 lead ECG is normal, then you will the next best investigation will be Holter monitor ECG or 24-hour ECG. Another differential diagnosis is postural hypotension. So in a scenario of postural hypotension, I will mention that the person become unconscious after standing up, and there will be a history of polypharmacy as well. How we are going to diagnose postural hypotension? We'll measure the BP while lying down and 3 minutes after standing up. There will be a difference of 20 mmHg of systolic blood pressure and 10 mmHg of diastolic blood pressure in case of postural hypotension. Seizure can also lead to syncope, but in a scenario of seizure, there will be usually an eyewitness who witnessed the seizure, and in case of seizure, there is usually a postictal drowsiness or confusion. Syncope, in cardiac syncopial events, there is no postictal drowsiness or confusion. There is usually flushing or flushing of the face after a cardiac syncopial event, while in case of seizure, there will be drowsiness and confusion after the syncopal attack. So these points are important to remember to differentiate between seizure and cardiac syncope. Now hypoglycemia, the fourth one, an important cause. Hypoglycemia, remember that a person who become unconscious due to hypoglycemia, he cannot become conscious on his own unless you correct the hypoglycemia. And also there will be history of excessive alcohol intake, because chronic alcoholic can develop hypoglycemia. And also before becoming unconscious, there will be history of sweating, tachycardia, or confusion before falling. But investigation you will order, you will check blood glucose level if you are suspecting hypoglycemia. So a short summary of all these four causes of syncope. When you will suspect a cardiac syncope, the patient will become conscious on his own after 2 to 3 minutes, and after becoming conscious, there will be flushing. And patient will usually lose his conscious level abruptly, and there will be no sweating or tachycardia or hypotension before the attack. And a person with polypharmacy, then you will suspect postural hypotension, and you will measure his BP while lying and 3 minutes after standing. And in a scenario of seizure, there will be an eyewitness who will confirm the seizure, and there will be post-ictal drowsiness and confusion. And in case of hypoglycemia, there will be history of alcohol intake, and before becoming unconscious, there will be sweating, tachycardia, and hypotension, etc. Cardiac syncope the cause of cardiac syncope is undiagnosed on the ECG. If diagnosis cannot be made on ECG, then 12, 24-hour ECG monitoring or Holter monitor ECG. Another cause of sudden fall is vasovagal attack. Vasovagal attack. What are vasovagal attack? Uh, the vagal system is stimulated, which lead to bradycardia and vasodilation and decrease blood supply to the brain. So in a vasovagal attack, the person can become unconscious as well. What can cause vasovagal attacks? There will be history of prolonged standing, straining or pooping or heavy weight lifting or after visual stimuli such as seeing blood. All of these things, prolonged standing and straining and pooping, they increase the pressure, abdominal pressure or thoracic pressure, which leads to stimulation of the vagus nerve, which result in decreased heart rate and vasodilation, due to which blood supply to the brain is decreased and the person become unconscious. Also, visual stimuli such as seeing blood can also stimulate the vagus nerve. So, to diagnose vasovagal attacks, you need to focus on the history. If there's a history, if the person become unconscious after prolonged standing or straining or lifting heavy weight or after seeing blood, then the diagnosis will be most likely be a vasovagal attack. The patient of vasovagal attack are usually young females. Another differential diagnosis of sudden fall is drop attack. What is a drop attack? Sudden fall without losing consciousness. And the drop attacks, the patient is usually conscious. For example, any problem in the spinal cord or lower limb weakness such as cardiac venia syndrome can lead to a drop attack. So this was all about differential diagnosis of syncope and sudden falls. Stokes-Adams syndrome. So Stokes-Adams, what is Stokes-Adams attack or Stokes-Adams syndrome? Remember that we discussed third degree heart block yesterday, and that in third degree heart block, the impulses are blocked in the AV node and they are not transmitted to the ventricles. And when this happens, the heart is unable to pump enough blood for a few seconds, and the blood supply to the brain is decreased, which leads to the person becoming unconsciousness. So if the heart problem or irregular rhythm or arrhythmia is diagnosed on ECG, and then the next investigation will be echocardiogram. If it's not diagnosed on the 12 lead ECG, then the next best investigation will be a Holter monitor ECG. Is it clear, everyone, up to this point? Now, alcoholic heart disease or alcohol cardiomyopathy. Someone with a history of chronic alcohol intake present to you with features of heart failure, then the diagnosis will be alcoholic cardiomyopathy. Remember that drinking too much alcohol over a long period of time can weaken the heart muscles, due to which heart is unable to pump blood properly. So long-term alcohol intake can result in heart failure, because Uh, Alcohol has a direct toxic effect on heart muscles, and also it generates free radicals which damages the heart muscles. So chronic alcoholism can lead to heart failure. So someone with a history of chronic alcoholism present to you with ankle swelling, orthopnea, shortness of breath, ascites. In short, if chronic alcoholic present to you with features of heart failure, then the diagnosis will be alcoholic cardiomyopathy. Cardiac shadow will be enlarged on ECG, and remember that whenever there is enlargement of the cardiac muscles, there is always a risk of atrial fibrillation. So if in the exam they ask you about the most common type of arrhythmia that can develop in alcoholic cardiomyopathy, then your answer will be atrial fibrillation. Now some points about dilated cardiomyopathy and hypertrophic cardiomyopathy. Remember that dilated cardiomyopathy can be genetic or it can be caused by alcohol, or it can occur in pregnancy as well. And hypertrophic cardiomyopathy is also a genetic condition. So how you are going to diagnose dilated cardiomyopathy and hypertrophic cardiomyopathy? They are diagnosed on echocardiogram. If ejection fraction is decreased and septal wall thickness is decreased as well, then it will be dilated cardiomyopathy. And in hypertrophic cardiomyopathy, as there is hypertrophy of the heart muscles, so ejection fraction will be increased and septal wall thickness will also be increased in hypertrophic cardiomyopathy. Dilated cardiomyopathy can cause atrial fibrillation, and dilation of the heart chambers can also result in mitral regurgitation or regurgitant murmurs. The causes of dilated cardiomyopathy, as I have already told you, that alcohol can cause dilated cardiomyopathy. In postpartum period, dilated cardiomyopathy can occur, and also hypertension can also cause dilated cardiomyopathy. There are genetic causes of dilated cardiomyopathy as well. Now, the last topic for today is familial hypercholesterolemia. Familial hypercholesterolemia is a genetic disorder. So, for the diagnosis of familial hypercholesterolemia in Plab 1 exam, there should be a family history of MI in first degree relative before the age of 60 or second degree relative below the age of 50. So, familial hypercholesterolemia is a genetic disorder in which there is a defect on chromosome number 19. This defect makes the body unable to remove low density lipoproteins or bad cholesterol from the blood, which leads to high cholesterol level. So, a patient who present to you with hypercholesterolemia and with a family history of MI, then your diagnosis will be familial hypercholesterolemia. Another topic is atrial myxoma. Atrial myxoma is basically a tumor of the left atrium or tumor of the atrial muscles. In 75% of the cases, the tumor is present in the left atrium, while in 25% of the cases, it can be present in the right atrium as well. So if there's a tumor in the left atrium, what will happen? The tumor is present in the left atrium. It can lead to the obstruction of the mitral wall. It will obstruct the flow of the blood from atria to the ventricles. So the feature of mitral stenosis will be present because there is obstruction to the blood flow, which also happen in case of mitral stenosis because the walls become narrow in mitral stenosis. So the features of mitral stenosis will be present, such as amid diastolic murmur, and also small pieces of this tumor can break off and travel to the large arteries, just like a clot can travel to the large arteries in atrial fibrillation. Similarly, in atrial myxoma, small pieces of this tumor can break off and they can travel to the arteries. So if they travel to the brain, it will result in stroke. Travel to the peripheries can result in limb ischemia or finger ischemia. And if they travel to the gut, they can result in ischemic colitis, etc. The diagnosis of atrial myxoma is made on echocardiography. On echocardiography, there will be a pedunculated heterogeneous mass that is typically attached to uh, the interatrial septum. And the treatment for atrial myxoma is surgery. The last topic is in hospital cardiac arrest algorithm. There are two pathways. If you see a collapsed patient or a sick patient in ward, the first step is you will shout out for help and assess the patient. What will you assess in the patient? You will see for the signs of life such as breathing, pulse, and movement. If there are no signs of life, then you will ring the emergency bell and call the resuscitation team and start the CPR. For every 30 compression, you will give two. For every compression, if there are no signs of life, you will ring the emergency bell and call the resuscitation team. Start the CPR with a 30:2. And advanced life support. CPR is basically a basic life support, and advanced life support means endotracheal intubation and other management. And if there are signs of life such as breathing or pulse is present, then you will follow the ABCDE approach and call the resuscitation team and hand over to the resuscitation team when they arrive. So there are two pathways. One is if the patient have a pulse or if the patient is breathing or there are signs of life, then you will follow the ABCDE approach. And if there are no signs of life or no pulse, you will ring the emergency bell and start the CPR and wait for the resuscitation team to arrive and ALS when the team arrives. And now some points about triple vessel disease. Triple vessel disease means, as the name implies, three major blood vessels that supplies the heart, which are left anterior descending artery, left circumflex artery, and right coronary artery. If these three major coronary blood vessels are blocked, then this is known as triple vessel disease. Which three vessels? Left anterior descending, left circumflex, and right coronary artery. What are the features of triple vessel disease on ECG? ST elevation in lead AVR with ST depression in multiple leads. So ST elevation in AVR with widespread ST depression indicates a triple vessel disease. Triple vessel disease means three major blood vessels that supplies the blood to the heart are blocked, such as left anterior descending, left circumflex, right coronary artery. Here is a ECG as an example of triple vessel disease. Uh, this is lead AVR. You can see that the ST segment is elevated. See, this is the baseline. So there's ST segment elevation in the lead AVR, while in all other lead, see in this lead 1, ST segment is depressed below the baseline, in lead 2 as well, in lead AVL as well, in chest lead as well. See, in V2, ST segment is depressed. V3, it is also depressed. In V4, it is even more depressed. This is baseline, and this is the ST segment is depressed. V5, V6. So, ST segment elevation in lead AVR and widespread ST depression indicates a triple vessel disease. Is this point clear to everyone?
Can you say the arteries which are
Left circumflex, left anterior descending, and right coronary artery.
okay? Thank you.
Patent foramen ovale. Foramen ovale is basically a communication during embryonic life, a communication between right atrium and left atrium, which allows the flow of blood from right atrium to left atrium because the lungs are not functioning in fetus or inside the womb. So there is a communication between right atrium and left atrium, which allows the flow of blood from right to left atrium. And usually after birth, this foramen ovale is closed, but in some patients it remain open, which is known as patent foramen ovale. The most important and significant complication of patent foramen ovale is paradoxical embolism. What is paradoxical embolism? Now, if someone in the Plab 1 exam, they ask you a scenario in which a patient with a history of DVT, the venous thrombus can travel to the lungs, resulting in the pulmonary embolism. But if someone with a history of venous thrombosis present to you with stroke, so remember that normally a venous thrombus cannot travel to the arteries. It normally the venous thrombus can only travel to the lungs, which will result in the venous thrombus travel to the systemic circulation, then it is known as paradoxical embolism. So paradoxical embolism is basically a complication of patent foramen ovale. So the venous thrombus can travel from right side to the left side of the systemic arteries, such as it is diagnosed on transesophageal echocardiography with bubble contrast. What is transesophageal echocardiography with bubble contrast? Bubble contrast is basically a saline is taken in a syringe and it is uh, mixed so that tiny bubbles are formed in the syringe, and then this bubble contrast of cell through a peripheral vein, and then echocardiography is done. So if on echocardiography we see these bubble moving from right atrium to left atrium, then it will make the diagnosis of patent foramen veil. So patent foramen veil is diagnosed by the presence of paradoxical embolism, and the diagnosis is confirmed by transesophageal echocardiography with bubble contrast. This was all about patent foramen veils, and we'll end our session here today. If someone has any question, then he is welcome to ask. Cardiology is almost finished. Tomorrow we'll start endocrinology, and as far as the mock test of cardiology and what was the previous chapter, neurology. So the mock test, the schedule for mock test of cardiology and neurology will be announced soon. And tomorrow we'll start endocrinology.
Okay. So there were a few topics for hyperkalemia and hypokalemia. Will we be discussing them in endocrinology?
Yes, hypokalemia and hyperkalemia, hypercalcemia and hypocalcemia, all of them will be discussed in endocrinology.
Okay, that's fine. Thank you very much.
And on 1st February, I'll let you know the schedule of mock test of cardiology and neurology.
Thank you.
So if you guys have no questions, then it's a goodbye from my side. I'll see you tomorrow on the same time. Until then, take care, Allah Hafiz, and good night.